Hey guys, welcome to week 4. This week we'll be covering 2 different PowerPoint lectures, so we're going to just get started. And let me pull up the PowerPoints. We're going to start with the Vibrio, Aeromonas, Plesiomonas, and Campylobacter PowerPoint first. So let me put this into slideshow. Okay. So we'll start with the Vibrio species. Generally, Vibrio is going to be found in water environments. And so they're mainly causing gastrointestinal diarrhea type infections. The one that you're probably going to be familiar with, or at least have heard of, is going to be Vibrio Cholera. The other ones are going to be Vibrio Hemolyticus, Vibrio Vulnificus, and then Vibrio Vulnificus. And I don't think we even talked about that last time because it's very unpathogenic, least pathogenic, if you will. The first one we'll definitely talk about, and we'll mention a couple things on the others. So for Vibrio, just keep in mind that we don't see this typically in the United States. This is typically something picked up in contaminated water that's more seen third world countries. I know Haiti a few years ago had a big cholera outbreak. So that wasn't just a couple of years ago. I think it was 2 to 3 years ago they had that outbreak there. So again, you're not going to find it here. So if you have somebody coming in that does grow a Vibrio cholera, I bet you anything if you ask them their travel history, where they've been, they probably have been to some country that would be connected with. So it's not something that we usually see in the United States. All right, so Vibrio are all gram-neg rods. Sometimes they're said to be slightly curved gram-neg rods. They are facultatively anaerobic, so basically they can grow with air or without oxygen. Oxidase positive. Just last week, we talked all about the Enterobacteriaceae group and how they were all oxidase negative. Vibrio are very much oxidase positive. So again, whenever we gram stain, we see it's a gram-neg rod, we oxidase right away after a gram-neg rod, and that kind of starts to tell us what type of gram-neg rod it has. If it's oxidase negative, we're usually thinking it's one of those big Enterobacteriaceae group bacteria. If it's oxidase positive, there's some others that we know out there, one of which is Vibrio. It is catalase positive, does reduce nitrate to nitrite, and then there's this string test that you can do, and with Vibrio, it tends to have a positive string test. Basically, you're putting the organism into a solution that's a sodium desoxycolate solution, excuse me, that's not an easy word to say, and it will have this stringing reaction that will take place afterwards. Let me see if I can get this link to open to show you. Let's see if it opens it up for me. Because it's always nice when you can see like a result with it. I should have had this open earlier, I apologize, but yeah. So there's this nice little page on it, and what I liked the best was the picture, of course. So hopefully, yeah, you should be able to see this. I'm sharing my screen. So there's the stringing from the inoculating loop there, how it does that. So that's what the string test is. And again, it says right here, the purpose of the string test. It's going to differentiate Vibrio, especially Vibrio cholera, because that's our main pathogen out of the Vibrio group, from Aeromonas and Plesiomonas. Aeromonas and Plesiomonas are 2 that we'll talk about here in a minute. They are also from water sources. All of these come from water sources. They all cause diarrhea, so they kind of are seen similarly. So this is just going to help tell them apart. So again, Vibrio will be positive for the string test, whereas that Aeromonas is going to be negative. So hopefully that helps put it into perspective. All right, Vibrio is also halophilic, meaning it loves salt. So it typically is found in water that has some salt water mixed in with it. So it's not just always fresh water. It loves salt, so it wants to be in salt water. Except Vibrio cholera. Vibrio cholera doesn't love salt like the rest of them do. They do grow in blood agar and chocolate, just like other bacteria. There also is a specific agar that will grow just Vibrio if you're looking for it, called TCBS agar. I would remember that is used to grow Vibrio. So basically, it will separate fermenters. So we're looking at sucrose fermentation in this case. If it does ferment sucrose, it's yellow colonies. If it's a non-sucrose fermenter, it's a green colony. So when Vibrio goes on, this TCBS agar, cholera will be yellow. The other Vibrios that I mentioned will be green. So that agar will really help make sure cholera stands out if it's present, because that's our main pathogen. So I don't know the way that I remember this agar, and it's going to sound stupid, but it sticks in my head, I don't know if anybody was familiar with TCBY yogurt. There's a whole frozen yogurt store called TCBY yogurts. I always used to think, oh, I'm going to go to TCBY and get cholera. Like, it's the dumbest little thing, but it sticks with me. I don't know. Use what you can. All right, so let's talk a little bit on cholera specifically. So it very much causes different epidemics. Like I mentioned, the one with Haiti, contaminated water is the biggest problem. It can also be seen with fish, seafood. The key characteristic here is what we call rice water stools. That is the biggest sign of cholera, is these rice water stools, and you're having 10 to 30 a day. I mean, can you imagine? I don't think they get off the toilet. Like, that's insane. So basically, what a rice water stool is extreme liquid. It's extremely watery, liquidy. And then they get these little flecks of mucus in this watery diarrhea. And so the flecks of mucus look like rice. So that's why you term it rice water stools. The biggest risk with this disease and what harms these people the most is dehydrating themselves out, which can lead to shock from having low blood volume, hypovolemic shock, puts you into a metabolic acidosis state, and then eventually death. And remember, this is occurring in third world developing type countries that don't have healthcare that's that great. They don't have a lot of money, that kind of thing to help them out. So all of it together is just not a pretty picture. So the way that Vibrio cholera causes these extremely watery rice water stools is through the toxin it produces called the cholera toxin. Basically, it goes in and it destroys the intestinal cells and causes them to secrete the electrolytes and water out of them in diarrhea form. And so it's secreting out tons of your water, basically all this water out, along with all your sodium, potassium, all your electrolytes that keep you hydrated. So all of this together leads to this scenario of cholera. All right, Vibrio Hemolyticus also causes gastroenteritis. This is not as severe as the cholera, but again, found in water environments. Loves salts. Cholera wasn't as much salt water, but this one does love salts. Can be found in the United States here. So if we do grow a Vibrio, maybe it's one of this one. Some watery diarrhea, moderate cramps, but again, not anything compared to the last one. And then Vibrio Vulnificus, also contaminated water or seafood fish. This is a huge cause of septicemia that is very deadly to the patient. So that's the big worry with Vulnificus is what we call fatal septicemia. So a lot of times it can develop very rapidly upon exposure to that patient. So it develops quickly, results immediately into the septicemia, if you will, and causes liver dysfunction along with it. You can get it through wound infections, and then it can go to necrotizing fasciitis. So it is a nasty little bugger. It is not to be taken lightly, that's for sure. Okay, so those are your three main Vibrio organisms that you need to know. On to Aeromonas. Aeromonas is also gram-negative, also oxidase positive. Remember, it's string test negative like we saw in that other slot page. Also coming from water environments, in this case freshwater and marine, meaning salt water. And again, it will grow on blood agar, chocolate agar. So typically gastroenteritis again. So like I said, it's very similar to Vibrio in that it comes from contaminated water. They're both gram-negative, oxidase positive, causing gastroenteritis. That's why that string test is nice because it'll help separate the two of them. Most commonly, you'll see Aeromonas caviae, especially in children or the elderly. There are some that are associated with wound infections. Typically, it's Aeromonas hydrophila. It can result in septicemia. Any bacteria really could result in septicemia if it wants, and meningitis. I don't ask you a ton of things about Aeromonas. Mostly just remember its main characteristics. And then Plesiomonas, again, gram-negative, oxidase positive, negative for the string test, and again, associated with water. Typically, it's just fresh water, not any salt water on this one. The only species that we need to worry about is Plasmonis Sugaloides, and again, grows on blood and chocolate agar. So gastroenteritis. So the nice thing about Vibrio, Aeromonas, and Plesiomonas is they all have a lot of the same features to remember. So there's just a few key differences between them, and then the big boys to remember are usually in the Vibrio species. On to Campylobacter and Helicobacter. These are some things that we commonly see in the microlab. So we'll start with Campylobacter, gram-negative rods, curved, and they're said to be called seagull wings when you look at them on the gram stain. So I don't know if you ever drew out your little bird as like a little M kind of on your drawings when you're a little kid. It's kind of like that curve to the what they were supposed to be wings. So it's kind of supposed to be like that, a gram negro that's curved to look like those seagull wings. Oxidase positive, Campylobacter are non-fermenters, and you generally associate this with gastroenteritis coming from food poisoning. So Campylobacter is one that when somebody comes in with diarrhea and we're looking at a stool culture, you know, we're looking at E. coli 0157, Shigella, Salmonella, just like we spoke of last week. But we also look for Campylobacter, especially Campylobacter jejuni. That is a very commonly linked one with food poisoning as well. So that is commonly screened with our stool cultures along with those other guys from last week. So it will typically come from chicken that's raw or dairy products. Now the one unique thing here about Campylobacter jejuni is it likes a little bit of a warmer temperature. It wants 42 degrees Celsius to grow and not just your typical 35 to 37. So if you are screening stool cultures, a lot of times what they'll do is they'll set up the stool culture to, you know, the plates like blood agar, chocolate agar, McConkey, whatever. And they'll set an extra blood agar plate into a 42-degree environment. So they'll set the other ones in the normal incubator, and then they'll take another blood agar plate and put that into a 42-degree environment incubator. So here are your different Campylobacters. Again, Campylobacter jejuni, gastroenteritis, bacterial diarrhea, very common cause. That's definitely something we're always screening for. One of the test results that go with this is it is well known to be hipurate hydrolysis positive. That will help separate it from the other Campylobacters. Campylobacter coli is also associated with gastroenteritis, just not as commonly as jejuni. Campylobacter foetus causes bacteremias. And then concisus and curvus go more with periodontal disease. Helicobacter pylori, also a curved gram-neg rod, oxidase positive. Huge characteristic of Helicobacter pylori is that it is urease positive. That is a very big characteristic for it, is that urea positive. And again, urea, when it becomes positive, will turn a bright pink color for positivity. So that's a big characteristic. H. pylori, which you probably have heard of, it causes your ulcers and gastritis. A lot of times people get those from stress and things like that. You can look for H. pylori through antibodies, through like a blood test. That's a common way to diagnose people with H. pylori. You can do a breath test, which I've never seen that one done. I don't know if that's done much. Or what's also commonly done is biopsies. We're not usually growing this out on agar and identifying it that way. So my last lab that I worked in, and I worked micro, we basically would get the biopsies. So they would come down from surgery or wherever in the hospital, and we would plop them into this little kit. And what's in this little kit was urea agar. So we would just place them in this little urea because H. pylori is so strongly urease positive. So we put them in this little urea agar, throw them in the incubator. The next day we would read them. If it was bright pink, it was positive. They had H. pylori. If it was yellow, I think it was yellow, that was the negative, they didn't. You know, it was that simple. And that was a very common way to test and diagnose H. pylori, was through the biopsy, or the other common way is, again, through blood. All right, so that is it for this first chapter. Hopefully that doesn't seem too overwhelming. A lot of these are put together, as you can see, because they all share common features. They were all curved gram-neg rods. They were all oxidase positive. So they do, and they almost all of them cause gastroenteritis or diarrhea. It seems like there's a few exceptions, but you can see why they were grouped together like this. They are very similar. All right, let's go to our other PowerPoints. Put it in slideshow form. Okay. So these, again, are going to all be gram-neg rods, and these are very well-known non-fermenting gram-neg rods. So that is why they are grouped together. They are also all oxidase positive in this PowerPoint as well. So this whole week was oxidase positive gram-neg rods. So typically, because they're non-fermenters, they won't really change TSI, LIA agars with acid production, and most of these are going to be found out of the environment with our soil, water, or vegetation. So we'll start with Pseudomonas, Stenotrophomonas, and Acinetobacter. Pseudomonas is a very popular guy in the lab. He is definitely one you will see, and you should be able to play with him in your labs. And he's so pretty when you see him. I don't know why it's a him. It's so pretty when you see it. All right, so like I said, all non-fermenters, they're all gram-neg rods, oxidase positive. They're also catalase positive, and they tend to be motile. So Pseudomonas is known to produce a pigment. And so all Pseudomonas species will produce the first pigment, pyoverdin. And just like the name implies, verd for green, it is a yellow-green pigment, and it's typically water-soluble. So it will give this color. When you grow it on agar, it's going to have a color to it, a yellow-green coloring. And so that's all Pseudomonas species. Pseudomonas Originosa, which is the most popular out of the Pseudomonas that we see in the lab, has a second pigment that it will produce, and that is Piocyanin, and cyan for blue. So in this case, it's a blue or blue-green pigment. So altogether, it looks like this really pretty metallic-y sheen that has all these colors to it because of the pigments that get produced. So Pseudomonas Originosa will produce both pigments. All Pseudomonas will produce just the one. The rest don't produce the Piocyanin except Originosa. The other neat thing is Pseudomonas Originosa has a very distinctive odor to it. I mean, I think it smells like grapes. I do feel it does smell like grapes. But I have a lot of students that also think it smells like tortilla shells. So you have to figure it out when you go to lab. Do you think it smells like tortillas, or do you think it smells like grapes? I smell grapes. I don't smell tortillas, but a lot of students think tortillas. All right, so a little bit more on Pseudomonas Originosa, since that's the most common out of them. Excuse me. It is a leading cause of respiratory tract infections that are nosocomial-based, especially in cystic fibrosis patients. They're well-known linked to lung infections in cystic fibrosis patients. Otherwise, you will commonly see them with UTIs, wound infections, burns, that kind of thing. The other thing that they love is they love warm, wet environments like a hot tub. And so you might hear of swimmer's ear. Pseudomonas Originosa has well-known cause swimmer's ear, which is an external ear infection from being in hot tubs. Hot tubs are nasty little environments for bacteria. People don't realize how much they thrive in water that is warm like that. Oh, God, that's like heaven to them. All right, so we do grow Pseudomonas typically 35 to 37. They can grow warmer, but you just put them in the incubator at 35 to 37 like everything else. Some other Pseudomonas are pretty low virulence. Once in a while, you'll see them pop up with a UTI wound, but they're not going to be anything too much. You got fluorescens or putida here. And then Stutzeri, very rarely isolated, so I'm not going to focus on this one at all. All right, switching over to Stenotrophomonas Multophilia, shares a lot of the same features as Pseudomonas. It doesn't make any pigments, really. I'm thinking of something, that's why I paused. Yeah, so I'm going to leave it at that. Found in water, gram-neg rod again. This one is oxidase negative. That does change it. Pseudomonas, very much oxidase positive. Stenotrophomonas is oxidase negative, so just highlight that because I know we've been talking a lot of oxidase positive. Hospital environments commonly found, so nosocomial type infections. Not really seen outside of that, typically just nosocomial based UTIs or things that are associated post-surgery. Acinetobacter, oxidase negative as well, just like Stenotrophomonas. Non-motile, not motile, but non-motile. The Pseudomonas were typically motile. And so this one, again, hospital environments, just like Stenotrophomonas. Unusual to see it outside of the hospital, nosocomial-based infections. You will see this pop up in your lab from time to time based on those nosocomial infections. Okay, Burkholderia. So Burkholderia cepacia is also a non-fermenter that's a gram-neg rod, oxidase positive, and this is also heavily associated with cystic fibrosis patients. So both Pseudomonas and Burkholderia are commonly seen with pneumonia, lung infections with cystic fibrosis. Can cause some other things like UTIs, wound infections, and then Burkholderia cepacia tends to smell like dirt. That is kind of one of its characteristics, is this dirt-like odor. Burkholderia malii is what's responsible for what we call glander's disease. This is more of a zoonotic infection that affects more horses, mules, donkeys. Pretty rare in humans, but why we need to know it is it can be launched as a bioterrorism weapon. So just always keep that in mind. And remember that Burkholderia malii causes glanders. And Burkholderia pseudomalii causes melioidosis. So you do need to remember that. Melioidosis is a pulmonary infection, so it forms abscesses in the lungs. Again, oxidase positive, motile, gram-neg rod, found in the water soil, so causes melioidosis. And then some other non-fermenting gram-neg rods. We have alkalogens. This is said to smell like strawberries, or they call it a fruity odor, strawberry odor. Basically, Alkalogens faecalis is the only one we're really worried about out of the group. And then you have Flavobacteriae, and this is a yellow pigmented colonies that go with this one. Gram-neg rod, oxidase positive. In this grouping, there's some here, Christiobacterium, Elizabeth Kingia, and Spingo. I used to talk about these separately, and then I just stopped because they're not that common, so I just stopped talking about them for ease of discussion. I put them all together here. Soil, water, hospital environment, so you kind of get there's a theme here with these, why these things have been grouped together. And so that's it. Okay, so make sure you do your homework, go to lab, play with these items. You'll definitely should be able to see Pseudomonas out of anything that we talked about today. So that should be fun for you. If you have any questions, as always, please feel free to reach out at any time. Have a great week, you guys. La la la. La la.